Approximately 6 million people worldwide are affected by a primary immunodeficiency. Unfortunately, 70 to 90% of these are living undiagnosed. Primary immunodeficiencies are a group of rare chronic disorders characterized by an immune system that is not functioning as it should. Individuals affected by a primary immunodeficiency are susceptible to recurrent infections, autoimmune conditions, and other complications. These conditions are largely genetic, but in some cases can be spontaneous. Now, World Primary Immunodeficiency Week is celebrated in the last week of April every year. This year, for World Primary Immunodeficiency Week, we have come together under the theme, See the Unseen. The aim is to uncover stories behind people affected by primary immunodeficiencies, while calling for a collaborative effort between the general public, healthcare professionals, and the primary immunodeficiency community at large to ensure that we drive earlier diagnosis, have effective treatment plans, and ultimately save lives. Now, in this part of the series, we shall be joined by Dr. Barasa, who is actively involved in raising awareness for primary immunodeficiencies. She is a consultant pathologist and lecturer at the University of Nairobi, Faculty of Health Sciences, and also the chairperson of the African Society for Primary Immunodeficiencies.
My name is Dr. Barasa. I am a pathologist at the University of Nairobi, Department of Human Pathology, Unit of Immunology. So primary immunodeficiencies are genetic disorders where someone is born with a problem with the immune system. And why they matter is because they present with recurrent infections. And so these are patients who are always sick with one infection or another and are always being hospitalized. And that's why they matter. Primary immunodeficiencies are missed or misdiagnosed because many people are unaware of their existence. So if you don't know that something exists, you're not going to look for it. So warning signs would be the recurrent infections, and these tend to be severe infections, persistent infections, unusual infections, affecting different sites. And there are what are called the warning signs, which should make someone think about the presence or give a clue as to the presence of a primary immunodeficiency. For example, in children, if they have 4 or more ear infections in a year, that would be unusual. For adults, 2 or more ear infections. Pneumonias are considered very severe infections, so 2 or more pneumonias in a child in a year. 1 or more pneumonia in an adult over more than 1 year would be unusual. For children, there tends to be failure to thrive, so they're not growing well, they're not picking up weight, not growing in stature. Infections such as persistent oral thrush in the mouth, which is a fungal infection, would give a clue as to the presence of an immune disorder. And one of the most important factors is family history, if there's been another member of the family who has had a primary immunodeficiency, because these are genetic disorders, so they tend to run in families. So early diagnosis is important because when you detect the disease early, you're able to intervene with appropriate medication, aside from treating any infections that might be there. And this tends to give better quality of life to the patients, because now you're reducing the amount of hospitalizations that they may have. Okay, awareness is still low, but it's growing, it's improving because of several campaigns that have been done in this area. However, one of the major challenges is access to diagnostics. Many of the diagnostic tests actually involve evaluation of the immune system, and these tend to be very sophisticated tests. Many countries do not have centers that can perform this test, so they have to be sent out of the country. And of course, that increases the cost of testing. So access to diagnostics, cost of diagnostics, and the same thing for treatment. Aside from antimicrobials to treat the infections, there are other drugs that may be needed which may not be accessible for many patients in Africa. So unique challenges would be, one, where do we send these patients? So even when there's been awareness creation, in many countries there are no specialized centers for treatment of primary immunodeficiencies. So that's one. Maybe, for curative treatments, giving the example of hematopoietic stem cell transplant, we might have to send outside Africa. Another challenge would also be the access to testing and access to therapy such as immunoglobulin replacement therapy. African Society for Immunodeficiencies is the regional society, regional meaning in Africa, that creates awareness, drives knowledge in terms of detection, diagnosis and treatment of PIDs, and every region has its society. So through educational campaigns, for example, we do something called the A Project, which is a one-day workshop that can be targeted to different cadres of health workers. For example, there can be one targeting lab professionals so that they know what important diagnostic tests are needed. There can be one targeting the doctors in the front line, the ones who are seeing patients, to make them aware, give them clues as to what to look for and what diagnostic tests they should request in these patients. Another way through which we create awareness is through organizing congresses. We hold biennial congresses. We also partner with the other regional societies. For example, there's an international alliance that comes together every year or every 2 years to hold educational workshops for young doctors who want to get more exposure in this field. So policy, for example, looking at, if we talk about health insurance, and this would have to happen through advocacy, maybe from the clinical side of things or from the patient side of things, enabling access to some of the life-saving medications such as immunoglobulin replacement through reimbursement, maybe for patients who have to receive it, or just putting it in as one of the medications that is covered through a national health insurance scheme can actually help with that. Probably adapting some of the screening immune evaluations as an essential test so that it's availed even if it's not at every center, maybe at every one or two referral centers, which will enable people to access these tests within country as opposed to sending them outside. Frontline health workers need to be educated. So awareness creation is where it starts. And once they know, probably they would need to know, if I detect or if I suspect that there's a primary immunodeficiencies, what do I do next? What tests can I do at my level? What tests can I send out? Which centers can I refer this patient to where there are maybe immunologists or other doctors working in this PID space so that they can continue care of the patient. So it's about communication and building referral networks. So you, as the frontline health worker, you need to be aware. If you have a patient, for example, who's always presenting with infections, aside from treating the infections, you need to ask yourself, is there something more? Is there an underlying disorder? Why is it this particular patient is always having an infection while others are not? So that's the first thing to pick up. Delayed diagnosis actually causes first financial constraint in families, because this means there'll be very frequent hospitalizations, and they would have to pay out of pocket sometimes for all these hospitalizations, emotional constraints in the family as well, because there's always a patient who is sick. So this would affect their caregivers in terms of, maybe missing work because you always have to go to the hospital. If it's an older child, this will interfere with their school going. Okay, yes, I think I have one story. There is a child who presented with recurrent infections in the first year of life from about 8 months of age. So within 3 months, he'd been treated for fever and pneumonia every single month. And when they were referred to us, we now suspected there could be an underlying immune disorder. And unfortunately, they were not from a very well-off family, so could not afford some of the sophisticated tests, but were able to do one test which told us this patient has low antibody levels. And at the time, the National Health Insurance Scheme in Kenya was covering for the cost of intravenous immunoglobulin. So we referred them to a public referral hospital, and they were able to start this monthly. And we were sort of happy that, okay, at least he's got this monthly immunoglobulin, and that reduced the frequency of admissions. Unfortunately, some months later, he got an infection and ended up passing away. And after that, the parents, didn't want to be involved in the PID or primary immunodeficiency space. They actually just moved on. But why I remember this story is because I thought we actually had a solution for this child. We were surprised by that death. So see the unseen would mean you need to look deeper into why a patient is having recurrent infections. So, not just treating this patient every time they come to you, but trying to unravel the why behind it and to figure out whether there could be something else that's underlying that is now causing this presentation. And this is actually what happens with a lot of patients with primary immunodeficiencies before they're detected. They've been to hospitals so many times because there's something underlying that people tend to miss out. So seeing the unseen, will be part of awareness creation in terms of these things exist, look for them. Collaboration between healthcare professionals and patients, patient societies, patient representatives is actually very key in driving advocacy for primary immunodeficiencies and in driving change in policy. I think it's easier for government to listen to a patient-backed move or suggestion, unlike or as opposed to just health workers saying, oh, we need this. When you have the patient voice, it's a stronger voice.